All right, welcome to another episode of Medicine Mondays. I am yours truly, Dr. Pierre, host of Medicine Mondays, host of the Empower Yourself for Better Health series, bringing you an important discussion on prostate cancer. And today we're going to focus on this discussion of prostate cancer, not because it's just Men's Health Month, right? Which again, I am biased, right? Not because it's just Men's Health Month, but we're going to talk about the second leading cause of cancer-related death in men. We're going to talk about a cancer that, if done correctly, if prevented, and we're going to talk about the word prevention here at this point. If we take the steps to kind of look for the signs, we have a almost 97 to 98% chance of survival, right? So if I told you that all you needed to do was do certain steps to prevent this type of cancer, or to just be aware of this type of cancer, you had a 98% chance of survival, would you take it? Of course, the answer is yes. So it's so important for us to really kind of focus on what the prostate does, right? And we'll give a little kind of an introduction on what the prostate does, why it's so important, just in our kind of normal day-to-day routine. And we'll talk about some of the risk factors and the symptoms, and some screening tests that we could possibly do to again kind of warn us as this cancer arises, right? So let's talk about the prostate just in general. Let's kind of give a quick little facts associated with the prostate. So the prostate gland located right next to the bladder, and it's actually located at the top of the urethra. And the main function, right? There's several, but the main function is to be able to produce fluid that helps transport our sperm. So kind of the seminal fluid. So that's one of the main primary functions of the prostate gland. The problem is when this gland, right, has issues, right, whether it becomes enlarged or aka has cancer, we can see how problems can arise, not only from a sexual dysfunction related aspect, but more importantly, just from a functional mechanical standpoint. Because of its location, and the urethra goes right through the prostate gland, if you're having any issues, any prostate enlargement due to cancer, just enlargement in general, and we've had a whole discussion on prostate, just enlarged prostate in the past, that you can have issues with just urinary function in and of itself. And as a hospital physician, I've taken care of quite a few patients who have suffered from enlarged prostate, who then end up having kidney related dysfunction because they're not urinating. Because again, when the kidneys produce the urine and it sends it to the bladder to go out, if the prostate is essentially blocking it from being released from the body, guess what? It kind of backtracks into the kidney and causes problems there. Not only infection, but also much worse, right? Again, we've had patients who've had to have like emergent procedures done because their prostate was so enlarged that they couldn't urinate. So definitely something for us to really think about. So let's give some facts as far as kind of prostate cancer, just so we're kind of aware of kind of what we're dealing with. So every 15 minutes, another American person dies from prostate cancer. There's about 93 deaths per day associated with prostate cancer. 1 in 8 men will have prostate cancer during their lifetime. Interesting fact that autopsies done on men over the age of 50, 1 in 3 men actually will have prostate cancer related cells. Not to say that they had any significant symptoms associated with prostate cancer, because they could have died from something else, but 1 in 3 men have prostate cancer cells going on. So that kind of tells you that even though it is the second leading cause of death in men, and thankfully it has a good 97-98% chance of survival, a lot of men have it who may not be very unsuspecting of it, right? So it's definitely the concern. And what we're going to talk about today obviously is the most important factor, kind of prevention, early detection, right? That's really the aspect. When we talk about prevention and how do we prevent this thing, I'm going to be really focusing on the aspect of early detection, recognizing what our prostate does. And if we know what our prostate does, if we start having issues, if we start having problems, then we're much able to kind of act on it, right? Because we're aware, like, hold on, like, I know I'm used to able to do this, but like now all of a sudden I'm having problems urinating, I'm having problems doing that or that. So let's talk about kind of, again, the aspect of prostate cancer in and of itself. So what are some causes, right? Because I always get a question, what causes prostate cancer? So we don't have, from a medicine standpoint, we don't have any direct cause. I can't say this one thing causes you to have prostate cancer, but what we can say is that there are a lot of risk factors associated with it. And I think it's important, right? Because if we understand what are risk factors, then we understand what we can do from detection and especially early prevention standpoint, right? So what are some of the risk factors? We know that, as for again, obviously, the older you get, the higher risk you have for having prostate cancer. So age is definitely a significant risk factor. And when we talk about kind of the diagnosing and the screening aspect of it, age does play a factor in, some of the tests that we run. We know that smoking history plays a significant factor. Again, I've talked about this before. If this is your first time watching or listening to me, you know that on smoking, like when you think of a disease, if you throw in smoking, the disease gets worse, right? It just is what it is. Again, I don't know why people still smoke, but I understand that, there's addiction where it is. Ethnicity is also a significant risk factor associated with prostate cancer. The reason being is that ethnicity also kind of falls in line with family history. And we know that family history plays a significant factor in prostate cancer. If you have a family history of an uncle, of your father, of a brother suffer from prostate cancer, that should put you on high alert that, I need to make sure I'm not dealing with any prostate cancer related issues as well too. So family history is a big thing. Ethnicity is a big thing as well. And the reason why we talk about ethnicity in the African American community, let's just give a breakdown, right? It was kind of sad, right? Kind of sad, but unfortunately not shocking, right? And that's one of the cases here. So let's break down like who kind of gets this cancer. 175 out of 100,000 black men get prostate cancer. If for the white community, that goes all the way down to 104. Asian community, 57 per 100,000. Hispanic community, 90 per 100,000. So if you're black, you almost have, again, almost like 3 or 4 times as much risk as an Asian person of getting it. You have almost like a 30 to 40% increase in getting it versus Hispanic. So ethnicity plays a significant factor, especially as a physician, as a black physician, and if I'm taking care of black patients, I need to be much aware of that diagnosis, right? Because I need to know that, if I have, my African American patients, I need to know, all right, what is going on with your prostate related issues? Are you having any prostate related issues? I need to be much more diligent in their community, right? And what we're going to talk about, which is unfortunate, especially when we talk about some of the kind of the diagnosis standpoint, and we talk about and again, I've talked about 97, 98%. That is when we catch it in its early stages. But the problem is if I catch it in the later stage, that 97, 98% sometimes goes all the way down to 40%, right? So imagine the significant difference I get if I catch it later. That's why, again, like with everything here on the channel, prevention, early detection will always be the key for us. So let's talk about some symptoms, again, associated, just so you can kind of mentally prepared for it, because I know that's probably what you're wondering, like, well, what are some symptoms I need to be looking out for if I or someone in my family members may be dealing with prostate related issues, which could be prostate cancer. Again, I'm not saying all prostate related issues are prostate cancer, but I'm just saying that if you have prostate related issues, you better make sure it's not prostate cancer. That's really the gist of it all. So dull pain in that lower kind of pelvic area, frequent urination, trouble urination, right? So again, you have that kind of that opposite spectrum, right? You can be going to the bathroom a lot, or you could be not going to the bathroom a lot, or you could be having pain, what we call kind of dysuria, when you go to the bathroom. Again, and think about this. When you have a water hose and you put your finger over the water hose, it takes a lot more pressure for the water to get by. So that's what occurs when the prostate enlarges on that pathway that urine typically travels. All of a sudden, it takes a lot more pressure, aka a lot more pain for you to get that. Painful ejaculation, we talked about how important prostate gland is in regards to sexual function. And then these are some of the issues that, if you start having these, again, on top of some of the urinary complaints, you better go find your doctor quickly. Pain in your lower back, loss of appetite, loss of weight, bone pain. Those are really strong concerns. And again, I'm not saying all back pain is associated with prostate cancer. I'm just saying that if you're having some of these urinary complaints and you start having some of these issues as well, kind of following it, definitely we need to be red alert. Definitely something we need to kind of be wary of, because we got to be there, ready to go. So let's talk about so those are the symptoms. So we'll talk about the diagnosis aspect of prostate cancer. There's really two processes associated with the diagnosis of prostate cancer. One is the screening. Like, what am I doing in the initial phase to see, like, does this person have prostate cancer? Now, if you look at TV, you're much aware of when men have to go to the doctor's office. Probably one of the reasons why men don't like to go to the doctor's office, and when they have to get the rectal exam. So the rectal exam is a digital rectal exam that we can do, especially because of the location on the prostate. We can actually feel if there is enlargement. We can feel if there's mass or nodules or something that's just very abnormal associated with the prostate, because the prostate is a smooth gland. So if I'm doing a prostate exam, right, and then all of a sudden I'm feeling like bumpy ridges, or I'm feeling more hard related nodules, I got to be concerned that something may be going on. What more men would much prefer is our blood test, right? And this is more common, known as the PSA, the prostate, screening antigen, right? So the prostate specific antigen, right? And it's one of the ways that we do it that doesn't, again, require the digital rectal exam, but we will actually monitor to see certain levels. And there's certain factors associated with the levels. Age plays a factor. Whether you have any other related dysfunctions, such as infection, can play a factor. If you just had sex, can play a factor. So there's a lot of different things that can fluctuate our PSA levels. So obviously, when you're doing this test, we usually tell you to refrain from any sexual encounters. Let us know if you're having any type of pain or discomfort, any type of urinary infection related standpoint, because we know that can skew our numbers. And the worst thing that happen is that our numbers get skewed because maybe you had sex the night before, and then all of a sudden we're checking and your PSA is like through the roof, and we're like sending you down this rabbit hole that we probably shouldn't need you to send if you were honest with it. So obviously, like I said before, be honest with your doctor. Let your doctor know what you're doing, just so, again, your doctor can make very well-informed decisions associated with it. So you get these abnormal tests, right? Let's say the PSA is elevated. Let's say the digital rectal exam is abnormal. Typically, we send you to our friends, the urologists, to kind of do more of a direct examination, right? A lot of times they may need to even do like a biopsy just to see if there's any issues or concerns. Sometimes we do imaging related studies as well. Again, we're not going to get to the nitty gritty on kind of some of the testing, but understanding that the first and foremost step is, one, recognizing some signs, recognizing your risk factors, following up with your personal physician to say, like, hey, I'm having these issues, I'm having these concerns. Can you just evaluate just to make sure, right, I don't have prostate cancer, right? Because again, and I'm going to break down this. I'm actually at the cancer.gov website, and I'll put the link in the description, just to kind of give a breakdown of what we're experiencing as far as prostate cancer really by the numbers. So the 5-year survival rate for prostate cancer right now is about 97.5%. 5-year survival rate. That is amazing. We have an estimated case load of about 248,000 cases for 2021 as far as prostate cancer, new prostate cancer is concerned, and we have an estimated total of about 34,000 deaths associated with prostate cancer. So again, it is still going to be the second leading cause of cancer-related deaths in men, but it is something, again, we want things like this, right? Watching videos like this, listening to podcasts like this is really going to be what's the next step that takes us to being informed of our health, and then taking action, right? Because it's one thing, I was listening, it's one thing to take in information, right? Like I never want you to watch my video, listen to the podcast or anything, and just take in the information. I want you to be able to act upon the information that you're taking, right? Because just taking in the information does you absolutely no good if you don't do no action on it, right? So it's about getting the information in, but more importantly, it's about acting upon the information that you receive. Let's go down here. Lifetime risk of developing prostate cancer. Again, this is cancer.gov. Approximately 12.5% of men will be diagnosed with prostate cancer at some point in their lifetime. Right. That's, again, is important. This is not only a frequent cancer that affects men, but this is one that kills a lot of us. Right. So again, we cannot downplay its importance. We cannot downplay the importance of, again, seeing that doctor and getting the follow-up that we need to do. We talked about this aspect here of localization, right? So if I catch it early, if I screen you early, I detect it early, you come to your doctor early with the symptoms and they do their due diligence, right? We know that if it's localized, right, your chance of survival is like 75%. But the second it starts spreading, right? And again, this isn't like a cancer that spreads in, a day, right? But again, if you give it some time to spread, all of a sudden that percent of cases, survival drops to like 13%, right? That's just the region. We're not even talking about if it spreads to the bones and all these other places. If it just spreads outside of the prostate cancer, you have a significant drop, right, in your survival rate. So it's extremely important to follow up with your doctors, recognize the symptoms, recognize your issues, and don't avoid us, right? Very important in that regards here. So, and again, and this is a nice little breakdown of how common this cancer is. Number one, obviously, breast cancer is number one with about 281,000 new cases estimated this year. But guess who's number two? Prostate cancer. Number two, about 248,000 with about 34,000 deaths, which we kind of mentioned, right? And you see lung cancer is number three. So prostate cancer, again, this is a cancer that we should be screaming from the rooftops to be aware of, to be wary of, especially because we know that the likely chance of us getting it sometime in our lifetime is so high in that regards. And again, we kind of gave the racial breakdown associated with it. Again, if you're Black, right, you need to be on high alert if you're Black, or if you have patients who are African American and Black as well, because you just have to be high alert. It just is what it is. There's really nothing I can say. And in the percentage of cases by age group, we see about 40% will be between the ages of 65 to 74. 32% 55 to 64, 15% 75 to 84, right? So again, a significant number, right? Significant things that, again, just kind of keep an eye on that. And this kind of focuses on the age being a risk factor. The older we get, the likely you are to have to deal with this prostate cancer. So again, it just is what it is. And again, and this graph is a good one, right? Because it talks about the death rate associated by race. And again, makes sense. If African Americans, right, get prostate cancer the most, guess who's gonna die the most from it, right? That just common sense right there. So that's really the discussion at hand, right? It's about the treatment aspect of and I've had some patients who've had to have the whole prostate removed. I've had some patients who've had to go on radiation, some patients who've had to go on chemotherapy. There's a lot of different aspects associated with the treatment of prostate cancer. But again, you can't even get to the end, right? And that's why usually when we, especially here in the lunch learning community, we don't focus too much on the treatment aspects of it, right? Because by the time you get to the treatment aspects of it, again, you're going and having a personal conversation with your doctor. My goal is to make it so that we do everything we can from the prevention, from the detection side, right, to protect you, right? That's it, and that's always will be the goal of mine. So again, prostate cancer, Men's Health Month kind of go hand in hand. Second leading cause of cancer-related death in men, right? Second most commonly diagnosed cancer, for 2021. So again, if that's not enough, right, to get either you, especially if you're a man watching this or listening to this, or making sure your family member is getting themselves together, I don't know what it is. Yours truly, Dr. Barry Pierre, and I'm gonna see you guys next week.